Welcome to tonight's event. We're calling this tonight Partnering for Warmth, Collaborative Strategies to Address Homelessness Through Warming Centers in Caldwell County. And tonight we're going to have 4 panels where we're going to talk to and hear a lot of different perspectives on how warming centers in Caldwell County work, how they operate, and maybe some questions that a lot of you out there may have or think about or not think about when we're dealing with warming stations. Our first panel has to do with with Western Piedmont Council of Government. We've got the Restart and we've got the DSS. We're talking about what is the state of Caldwell County. What are we looking at in the world of Caldwell County and the homelessness that we're dealing with. So to introduce the panel, I'm going to start with Jason. We'll start with you. Tell us a little bit about who you are, who you work with, and we'll work our way around the room this way.
Sure, thanks, Ben. My name is Jason Powell. I'm the program coordinator for Caldwell County Restart. Restart is the post-overdose response team that has been formulated here in Caldwell County. We are a division of emergency services, so we are boots on the ground folks that interact with individuals that are in active use, are seeking recovery, and looking for those pathways. So our team interacts quite frequently with the population that we'll be discussing tonight.
Thank you.
I'm Tara Swanson, Community Paramedic Program Coordinator for Caldwell County Emergency Services. Basically, we are the gap fillers, so when we identify someone who has needs, we try our best to connect them with appropriate resources. Our program is actually geared towards assisting high utilizers, and the crews can also make referrals.
I'm Kim Arnett, and I'm the Director of the Department of Social Services here in Caldwell. Our department is responsible for the administration and overseeing the delivery of economic services, also protective services for children and adults.
Hello, my name is James Anders. I am a homelessness response specialist with the Western Piedmont Council of Governments. Part of our team, my specialty area is more in line with mental health, crisis response, and substance abuse services.
My name is Chastity Haug. I am the Homeless Response Manager for Western Piedmont Council of Governments. We have a team of 5 specialists that has lots of expert skills, along with I have 20 plus years of housing services. As James mentioned, the mental health crisis, he has several 10 plus years in that, and along with that also housing experience. We have Shay Moore, who has the public health experiences. We have Mary Kendrick, who has a lot of the re-entry experience of those folks who are exiting out of prison or jail. Also, we have Rick Smith, who carries a lot of the health and mental health services that and we have Rachel Dillingham that comes with a lot of nonprofit communication and also the health field of working for those families that are in crisis.
So as you can see, there's a lot of experts in the room and a lot of teams are doing a lot of work. Kim, I'm going to do this first question for you. What are some misconceptions about homelessness, and how do you work to address these misconceptions in your outreach or educational efforts?
So unfortunately, I think that there's often a stigma attached with individuals who are experiencing homelessness. I think some of the misconceptions that we run into are people assume that anyone who is experiencing homelessness has a substance use disorder, or perhaps they have a mental illness, or they are involved with the criminal justice system, or sometimes people simply think that folks experiencing homelessness are not worthy of assistance and they make a choice to be homeless. I think that we do education through some information sessions that we provide through DSS, some resource fairs, trying to get information out to the community and to folks who work within community agencies about what these individuals are truly experiencing.
Good. Tara?
So basically what I try to do is assist people with realizing how close we could be. So when I hear someone talk about someone in that kind of situation, I have to step back and say, well, I mean, I'm one situation that I could possibly lose my job. So none of us is immune to it. It could be us. So I just try to put myself in the people's shoes that are in that situation and show that sympathy and empathy, like to educate others. Nobody is immune.
Jason, how about you? What are some common misconceptions about the homeless, and what do you guys do to address that?
Sure, thanks, Ben. So to kind of echo off of Kim, there's that, unfortunately, I think the large overarching theme that we start to see is this stigma and this dehumanization. We as society, we have to get back to thinking about humans as humans. Okay, every single person deserves everything that's afforded to them. Unfortunately, there are these misconceptions, those ideas that, folks, this is a choice, this is what they want. Tara, she said, some of us are 1-2 paychecks away from potentially being that same exact thing. So my team, again, I didn't really get into it, but we're assembled of paramedics and peer support specialists. And peer supports are folks that have that lived experience. That lived experience of they have been homeless. They have been incarcerated. They have been justice involved. So what more people than to be able to walk the walk and talk the talk and interact with these folks than the people that we bring to the table every day. So I think just us continuously thinking and looking at each of these people and folks as humans and not just somebody that's made bad choices and now we're going to just not accept and not help. So
good. Chastity, James, do you have anything to add?
Yeah, sure. Yeah, when we first started our program, our goal was to try to take a look at the data, see what was out there, and actually put names and faces to it.
Just make sure you talk to the mic.
Oh, sorry. Biggest thing we've discovered is there is a colossal diversity of needs. There are not one single case is the same. Some people do have mental health substance abuse issues. Some people are working families that just, due to some miscalculation, bad circumstances, you name it, they became homeless. And I think that's the biggest side of it for us that we've seen that, yeah, there is a huge diversity as far as what's going on out there.
Chastity, the next question, I'll start with you. There's also a belief that many homeless individuals are homeless because they want to be that way. They're unmotivated. And so Kim sort of touched on this a little bit. How do you involve homeless individuals themselves in the planning and delivery of outreach and support services? And what benefits have you seen from this participatory approach?
So I have found that you have homeless that really have just fallen into that space. And trying to find what their goals are and getting them set on those goals and ensuring that they can get connections to them so that way they can be successful and if they are making those achievements.
Jason, what about you?
ask me one more time there, Ben.
Oh, sorry. Homeless individuals are homeless because they want to be homeless, right? A lot of that, you hear that a lot. How do you involve homeless individuals themselves in planning and delivery of outreach and supportive services?
Sure. So, the core of what we do is based upon individuals making decisions. Poor decisions have been made potentially, for sure. But if we come along and are those folks that say, this is what you need to do right here, and pigeonhole them, and cookie cutter and say, this is the only solution to this. I want to be a part of the decisions that are going to be made for my life. How about you guys? Right? So unfortunately, there comes a time where you're just not going to come in and fix it with this wave of this magic wand or take this magic pill. There's going to be struggle, there's going to be strife. And I think that's something for folks out in the community to understand as well, that this is not instantaneous. This is not a fix that we're going to be able to go and swoop and keep these folks all, getting them sheltered, getting them the mental health that a lot of them need, and getting them the substance use disorder assistance that they need. Problematic and chaotic relationships with substances, people can put them in this place.
Yeah, there. Kim?
I just want to say, I think that we do not have enough opportunities for these individuals to talk about their situations and to educate us on what got them to where they are. I think that, and this is not an answer to your question, it's more of kind of food for thought. I think we need to establish or find ways to establish or create opportunities for these individuals to be able to communicate with the people, the authorities who are in charge of developing and improving these resources, so that they can have that first-hand knowledge of what these folks are experiencing.
Yeah, that's right. Tara, do you have anything to add?
As far as our program goes, we sit down with the person and then we make goals, a list of goals, short-term, long-term, and then we get their buy-in. If this is something that you can do short-term, let's mark one small goal off the list, and then you see motivation. It may take 10 times trying, but you just have to persevere.
We see that all the time. It's definitely a persistence thing. Sometimes it can be months, sometimes years.
We're not going to get it right the first time every time.
Yeah, that's right.
Those of us in the field have to understand that, and that's part of our idea, is kind of help educate folks to say that they're not going to get it right. We aren't going to get it right. How many times have we all get our things right the first time?
Yeah, I didn't. Yeah, that's right. Jason, I'll direct this next question at you. I know that both of your programs, basically 3 programs here up at the stage, are fairly new, but you guys have been in the field and on the ground experiencing this homeless population directly. Since starting, what are the biggest challenges you have faced in providing outreach and support to individuals experiencing homelessness?
Wow, there's some big ones in there, Ben. There are quite a bit of ebbs and flows for sure, and I'm sure the homeless team understands that. One day Tara might be ready. Yes, I'm sick and tired of being sick and tired. I'm sick and tired because it's been raining for 6 days. I'm ready to make this change. I'm ready to do this. Now I've changed my mind. You're out there. You've done this work. We do it all the time. We do that. But here's the thing. Again, going back to that humanization, that you need to keep having that hand out. And that's the whole idea and the whole concept of what our team does and what Tara's group does as well. Is like, when people want help, there needs to be a hand there every single time. If there's not a hand there, then we're losing people. We're losing people. We're not helping them. So finding the folks, number one, if they're on shelter, they're not just going to stay in one place. I guess the next panel you'll start to hear from our law enforcement brothers that they have their duty to kind of keep the peace and to do the things, and it's very difficult for them. But people don't stay in one place, so trying to find them and actually locate them for when they need it. Communication, phone numbers, things like that. Unless you're out and about and actually finding the folks, that's a very, very tough spot to be able to do. And if they're not there for a reason, like maybe they are incarcerated, maybe they're in the hospital, maybe they have got on a bus and gone to Kentucky. We don't know. So trying to keep up with them is very, very challenging.
Kim, Tara,
Some of the obstacles that I've kind of noticed for some of my patients is obviously going to be transportation. That's huge, trying to get to the health department to get the resources that they need. Now, trying to get them a government phone is not as simple as it was before. Getting them IDs so they can get a job. There are so many obstacles that these people face, and no wonder. It's like you take one step forward and then sometimes life throws you 3 steps back.
We have lots of services at the department that can help with food nutrition, that can help with insurance coverage for physical health needs, mental health needs. However, getting that information out to individuals who do not have a residence, they do not have access to a phone, they do not have access to social media, is difficult. And so, unfortunately, it's word of mouth a lot of times, and if you can't tell someone, then they can't tell someone else. And so it's very hard to get that information out there to them. We try to post things in community agencies and public areas, library, Yoke Fellow, different community agencies, but they may not be able to make it to those agencies.
Sure.
So that's a huge barrier for us as well.
Yeah.
I think that's, if I can just springboard off of what Kim said, I think that's a great thing that Tara and I get to do with DSS, is to be able to collaborate and do those things, because we, like I said, there's no more boots on the ground than paramedics, law enforcement, and firefighters, and we can be those voices and be those folks and be able to take that information to folks. And, that's what the whole concept of mobile integrated health is taking healthcare to people, helping folks, bring it to them, because, like you said, not everybody can get to our building. People can't get there, and so the homeless outreach team, us having information, the collaborative, we have a full-time employee that's now a collaboration between DSS and Restart to be able to, she's the one-stop shop, so as soon as we have somebody along those lines, that's an immediate field person that can do the work for DSS.
Right. Yeah. Chastity, I know that one of the biggest challenges for us is data, so if you could refer a little bit about this, if you don't mind, and talking about what the PIT count is. I know that is one of the challenges that we always deal with, about the numbers that we have to deal with. This chart sort of kind of describes that, if you don't mind explaining.
Yeah, we consist of doing a point-in-time count that is designed by HUD for us to gather data for those that are unsheltered and sheltered in our communities. And that date and time is scheduled for HUD is always the last Wednesday in January. As you see on this graph, these are the numbers of the data that has been collected. Most folks will think that those numbers are skewed, they're not correct, and we know that that possibly could be true, and we want to ensure that that data is accurate. So one of the things that our team does is that we do put into our HMIS, and that data is collected. And as you see here, we will see it for increase in that. And over time, each year, those numbers do change and fluctuate each year.
So basically, this chart is talking about the unsheltered that were on this point, and the point in time count of this year, and that number you're referring to is 22. So basically, this number says in Caldwell County, there are 22 unsheltered people, but we know that that's not an accurate number. And I think this is important. As being a part of everything that every one of the agencies do, and we've heard it over and over so far, is about the information and the data is critical. And I think by having these organizations that really are strategically focused on doing this very thing, allows the county, not only do we do Caldwell County, Alexander County, Burke, and Catawba, so this homeless response team gets to see it in 4 counties. We get to see the similarities, we get to see the differences. And what we see in Caldwell County is organizations like Restart, like what Tara's doing, and what we're doing. We're just there to assist, to really get those numbers and that data up to speed, so we know exactly what we're dealing with and know what resources we really truly need to focus on. And I think that's really key, and it's something that we always say. I don't mean to take the words out of your mouth, but I know that's an issue. Is there anything else? We've got one last question, but I wanted to make sure that if you or James had anything else to add.
Yeah, with the point-in-time count this year, the one thing about the point-in-time is that it is supposed to be just one night, which this year was January 31st, end of the month. A lot of people were in hotels who had money. People who didn't have money, there was a warming station going on at the time as well. Those people are considered sheltered, so they did not make that count on this time. So there's some tweaking that needs to be going on, and that's why we're looking on trying to do a summer point-in-time count to get kind of a better idea of what is out there, especially with different seasons and everything.
And that a summer point-in-time count, I think, is critical. That is something that's not really done and you guys will be directing that with the help of, I know, agencies in all 4 counties, but Caldwell in particular. I think it'll be interesting to see the data from what is in the middle of the winter, and to see what the data says in the summer when there's places you don't have shelters and you don't need to be hidden in the cover of forest. Final question. Seeing that you've all engaged directly with the homeless population, how can community members, how can organizations such as faith-based groups, other nonprofits, best support your work and contribute to the efforts addressing homelessness and emergency response needs in our community? I'll start. Tara, let you start this one.
So, I think communication and teamwork is huge. Our program does not have a budget, so therefore I rely heavily on our community resources already. So we reach out to Young Fellow for food. The First Baptist Church has also helped our program. So many members, I know community partners are wanting to help, and I think if we all come together in agreement and collaborate, that would be huge.
Great. Kim, while you're there,
So we collaborate quite a bit with community paramedics, with Restart. As Jason said, we have a social worker who is a liaison between our programs. I think that type of collaboration, working with the mental health agencies in the community, pulling them in, talking with them about what we're seeing, what they're seeing. We have a couple different teams that we run in the department, multidisciplinary teams, where we talk about what some of the individuals that we're serving, what they're facing, and bringing some of the community partners into those teams, talking about what's available. I think we need more of that in the community.
Yeah, Tara, you quickly.
Sorry,
No,
I didn't mean to leave out highways and hedges. I didn't want to put them in at the wrong time, but they played such a huge role. I could call them up and say, hey, this person needs a sleeping bag, or this person needs some food, or whatever it was. They were always there with their doors open, and I truly appreciate that.
Okay, great. Jason.
Sure. So as Tara and Kim both put, we talk a lot about the collaboration, and I think I've sat in a room with a lot of you guys for many other meetings, and I think this goes just kind of an overarching theme, not specifically here, but we need to de-silo. We need to stop working in our own individual spaces. We need to partner with folks. We need to let people know that we care. And there's not just Restart that cares. There's not just DSS and these specific folks that care. But we need to bring in the faith base. We need to have those folks that we're able to lean into and lean on, because we don't have all the answers. If we come across folks that need some assistance or want some assistance, we need to be able to have that information to then link them to those services and to those programs. We're routinely, it's active engagement is what we're doing. We know, and again, our space is substance use and those problematic and chaotic relationships that folks have with those substances. We know that's not always the case, that folks want help with that, but they want to eat, they want to drink, and they like to have something over their head. So if there's some way that we as my team, and Tara as she's out and about, and I know we talk when we do this, is to just do that active engagement. Stop on the corner and see somebody and talk to them. Ask them questions like a human being would. A lot of folks, when they come back and they actually reach back out to us, you're like, the last time that somebody's actually talked to me like a human and wanted and cared about what Chastity really happened to Chastity, that she's on the side of holding a sign? I will put a plug. There's a great song by Riley Green called Jesus Saves. If anybody wants to listen to that and just listen to the words, it's a fantastic song. It's exactly all about what we're talking about tonight.
Chastity, James?
Our biggest goal when we first got started is talking about assembling this data and finding the barriers, and then from there we want to address those barriers. So any faith-based partner, nonprofit group, of course, county and city governments, all these have a role to play in this situation, and that's what we want to do. We want to be the bridge for these types of services to help lead people to these various programs and help break those barriers. That being said, we are about to unveil a website that will kind of put everything in perspective. It will have some of our data numbers, also have different ways that we can address this situation through groups, things like that. And should be coming out anytime.
Yeah, it will be. By the time you have this, it'll be homelessresponse.org, and it will have information for Caldwell. It's got all the resources, not only for people that are looking to serve and assist the homeless population, but also agencies that, if you are homeless or in need, can point you in direction of that. And not only is it for Caldwell County, we also have it for all the other 4 counties that we serve, and with people doing similar work in these other counties. It's very fascinating to see the differences in the similarities between some of the approaches. It's good to see good people doing good things, trying to help and make a difference in the community. Jesse, is there anything you would like to help with closing?
Yes. As you go to our website, there will also be a QR code and a link that you'll be able to join if you'd like to be a part and join us for the summer point in time count or our winter point in time count, or be involved with us as we gather that information. Please be sure to go to our website, visit, join that as well.
Yeah, when this is posted, whether you're watching this on YouTube or whatever, there will be a link at the bottom for you to put your name in, so we can grab a database and share it with everybody here and some of the other panels that we have tonight. Ladies, gentlemen, thank you so much for your input and your guidance, everything, the hard work that you're doing. We really appreciate it. You're doing good things for Caldwell County, and keep up the good work.